Lebanon's Minister of Public Health, Dr. Firas Abiad, who joins us live now. Dr. Abiad, thank you very much for speaking to us at BBC News. Just bring us up to date in terms of the latest on the ground there. We saw the devastation in Beirut. Just can you confirm who has been killed in terms of the Hezbollah senior figures that the IDF is suggesting?
So this was a residential building, and we're still clearing the rubble and to see whether there are any survivors. Up till now, the number of people who were killed was much higher, I can report, than the one that came yesterday. And we will be issuing a report very soon with the latest tally that includes 3 children and 3 women. The report from Hezbollah is that 2 of its commanders were included within those who were killed on that attack.
So just in terms of when we're talking about at least 37 killed from the pager and walkie-talkie explosions, you're saying that that figure is higher, including 3 children?
No, the tally I was telling you about is from the attack on the building in the suburbs. The tally from the explosion is now actually higher than 37. We're reporting 2 additional deaths from the walkie-talkies and the pager explosion. We will be reporting them today.
Okay, thank you very much for just clarifying that. It's, of course, really critical to get the details correct. Dr. Abiad, how is the health service coping with the amount of casualties that you're seeing currently?
You know, I think it is a bit overwhelming in the sense that Lebanon has been suffering from multiple crises, as you know, and we've had a portion of our healthcare workers who have left the country as a consequence of the financial crisis. And that's why, you know, preparing for this conflict and these attacks that are ongoing has become pretty much challenging. Now, we have, activated our disaster management plans, anticipating a large number of casualties. And indeed, on Tuesday, we received almost 3,000 casualties in a matter of a few hours. One of the things that is making it more difficult is that really we are seeing also a lot of civilians that are being injured. I mean, these indiscriminate attacks, unfortunately, are also resulting in a lot of these civilians, and the geographical location is so wide because these pagers were used, by many people in their daily lives. And that meant that almost 90 hospitals had to be involved in the response to that attack.
As we were saying a little bit earlier, the United Nations High Commissioner for Human Rights, Kurt Volker, was saying that this is a violation of international law, the use of these civilian devices such as pagers and walkie-talkies. I assume that you would be in agreement with that.
I think it's a very clear violation. As I said, I mean, the international humanitarian law is very clear that there is an onus on, even during conflict, for the civilians to be isolated or not to be targeted. But unfortunately, what we are seeing within the recent conflicts is that, the parties involved are making no effort to differentiate or, the civilians. And unfortunately, that means it's making it much more difficult for healthcare systems such as ours to prepare for, the results of these attacks.
Israel argues that it has to target Hezbollah members because of the continuous firing into and the attacks on its border with Lebanon. What's your response?
I think that irrespective how you want to justify the conflict, but the fact that the international humanitarian law is very clear in the way that it organizes conflict, in the sense that during conflict, civilians have to be not targeted. And whoever is doing the target, whether it is Israel or anybody else, this is a violation of the international humanitarian law that should be stopped. The only problem with Israel is that they have a bigger weapon, so to speak, and therefore the tallies of what they are doing is much, much higher and more difficult to deal with.
Dr. Abiad, help us for our international audience just to understand, in terms of the population of Lebanon, how many people are Hezbollah members?
I don't think anybody knows. I mean, Hezbollah is a non-state actor, and as we don't have anybody have a good idea how many members there are. But the fact is, those children and those women who are killed were not members of Hezbollah. Those were civilians that happened to be nearby. And when those explosive devices or communication devices exploded, they exploded in hospitals, they exploded in markets, they exploded on the streets, and therefore, unfortunately, involved everyone else.
Dr. Firas Abiad, Lebanon's Minister of Public Health, thank you very much for joining us. And I know you're rushing off to give that press conference. We'll be monitoring that as well. Thank you for your time.